All right, next up, we want to move to our next speaker. This is about healthcare transition, and Dr. Patrick Burke. He joined Valley Children's as a pediatric hospitalist in December of 2014. He is a program director for young adult and transitional care, which is a newly established program aiming to provide transitioning adolescents with the tools and resources they need to succeed as adults. So please welcome Dr. Patrick Burke to the stage.
Good morning, and while we're welcoming our speakers up here, who more important than I are the youth and adolescent with chronic medical conditions and are succeedingly speaking to us, why don't we take a moment, we've been sitting down for a while, to stand up, levántanos, estrenos los brazos, etc., okay? Come on up, sit up, stand up, reach up. Ah, there we go. Sí, mucho más mejor, ¿no? And then if I could have our speakers come up to the table. And while they're coming up, you go, feel free to have a seat again if you feel like you've gotten that good stretch in, or if you feel like standing up the whole time, that's okay too. This is an informal gathering. And again, I am Patrick Burke. I'm trained as both a doctor for adults and a doctor for children, also known as internal medicine and pediatrics. And at Valley Children's, we are focused, just like Kern County, on the important and exciting transition from being a child to an adult, whether you have asthma or diabetes, complex heart disease, cerebral palsy, any chronic disease or disability. After hearing Dr. Sharma tell us about how universal this is, that what each of us might experience might not be too different from others like you across the country or even across the world. That tells us that this is important, that this is a shared experience. So let's bring this discussion back here to the Central Valley of California, back here, right here to Bakersfield, and let's understand it from teenagers and young adults' perspective, who are living this right now. So in a moment, I'm going to introduce you to our teenagers and young adult panelists. Before I do that, I want to make sure we are all equally aware of this picture that you have on either side, and that's the entire experience of a person with a chronic condition that goes beyond hospitals and doctors and offices and medicine. This is called a care map, and specifically from a 9-year-old girl with special health care needs named Lily. And a care map like Lily highlights school, finance, other supports, in addition to the joy in her life that keeps her going and that keeps her healthy and happy. Like Lily, our 4 panelists here will help us connect healthcare with other parts of their lives, which is so important. And in doing so, enlighten us and inspire us. So let's meet them now. Directly to my left, we'll start off with Angie. And if T in the back, we might need to pop on the people's mic. Here he comes running down the front aisle. Come on down. Go ahead, Angie. Hello. Oh, not quite. Oh,
No?
There
Okay.
you go.
There we go.
All right, it's live.
Okay. All right. So hello, everyone, and I would like to welcome everyone. My name's Angelica, and I am 21 years old. I just recently transitioned out of CCS. I just graduated as well from UCLA, and I will be moving to Virginia to pursue a master's in nursing. So it's a little bit about me.
Hi, good morning, everyone. My name is Jessica Rodriguez. I am 21 years old. I just transitioned out from CCS as well, and I am a CCS scholarship recipient from 2 years ago. And I'm attending to CSUB. This is my last semester, and I'm planning on doing my master's for education counseling to work with young children and motivate them. Thank you all for being here.
Good morning, everyone. My name is Daniela Ramos. I'm 15 years old. I'm a sophomore at Wasco High, and I've been a part of the CCS program ever since I was about 8 years old.
Good morning, everyone. My name is J.C. Aguirre. I live in Merced County, and I attend Merced Scholars Charter School. I am 15 years old, and I am an advocate for quality health care for children and youth with special health care needs. I want to give a shout out to all the Kern County CCS transition staff for putting this on here in Kern County and for inviting me here. I'm extremely pleased to be a part of it. Thank you.
Thanks, guys. So, what we'll cover are 3 topic areas, and then open up to our audience here for discussion and for additional questions. These 3 topics are overcoming challenges, getting health care and paying for health care, knowing the help you need and getting that help, and growing up and pursuing your dreams. So panelists, we'll start with helping our audience understand what each of you face when it comes to taking care of yourself, your own special health care needs, and to succeed at being healthy. We've already heard the challenges adolescents and young adults face across the nation and even worldwide as they become adults with a chronic condition. And it's important, though, that we understand and feel into that personal experience. And to keep us all clear, I want to divide our discussion into 2 parts. And that's about getting health care and paying for health care, or getting to your doctor and paying for the doctor. So, especially for our older panelists, can you share what specific experiences you've had paying for health care? Whether that's been money out of your pocket, or with your family, or your experiences with understanding and ensuring you had health insurance.
So I can talk a little bit more about it. At the age of 18, I was diagnosed with a hole in my heart, and it was something difficult for me and my family because we didn't know how we were gonna work it out in regard to the money. Thankfully, I got CCS, and they helped me out throughout my whole journey, and I believe that personally, I haven't experienced any negative outcomes in regards to money because I got everything taken well care of before the age of 21. Now I have current family, and it's also helping me out. So wherever CCS does not cover, current family will cover it for me. And I believe it has been a really great help to be receiving these help outside, because if it wasn't for CCS, I think it would have been more difficult in regards to the money when it came to my surgery.
Just to add a little bit onto her similar experience, I've been with CCS, I think my entire life. And, I never really took into consideration the cost for all these things just because it was something that it was never on my radar. I don't think it became, I don't think I became aware of, the costs for all these surgeries and, braces and all that stuff until after I turned 18. I think that after I became, after I, started to become an adult, I became aware of the cost, and so I've had my fair share of having to deal with, the hospital payroll people and stuff, but thankfully CCS has been very helpful. When I was a CCS, I would, just go to Tony and be like, Tony, I have a bill, please help me pay for this. So CCS has been wonderful, and now that I'm out, I'm worried because I'm gonna try to have to figure out how to, get another primary care insurance, like get insurance and find new specialists and all that stuff. So it is concerning.
So I've actually been a part of CCS ever since I was diagnosed with diabetes when I was about 8 years old, and have been taking care of all the medical costs. I've had some issues with getting CCS not taking care of some of my medications, but we got that under control thanks to the wonderful staff they have. And recently, we have been looking into the transition into adulthood to see what's going to be taking care of my medications once I do turn 18 or 21.
I've also been part of CCS since I was very little, but I've never really had experience paying with it. Most of my surgeries and other procedures covered under CCS with my special health care needs have been taken care of by the CCS department in my home county. And the difficulty I've had is there's a lot of back and forth argument between my health plan and CCS about who covers what. So that causes a little bit of confusion and delay in care sometimes. But over the years, it's gotten a little better as far as they've started to understand what part of me is covered under CCS and what part of me is covered under the health plan.
And so it sounds like hearing the four of you speak, while you've each ultimately gotten what you needed, it didn't stop with simply, well, okay, I've sent in some form to the doctor's office and everything helping well. You sometimes had to press a little extra. You had to go the extra mile. You had to reach out to the CCS office. And then when you move out of CCS, then that still continues, but in a different way. Any other experiences, Angelica, you've had in that regard?
I mean, I've had procedures done after, I've transitioned out of CCS, so I do have pending bills. And, I think the hardest thing for me has been understanding insurances and understanding having to get authorizations and just understanding the system overall, I think, has been the hardest part in my transition out.
Well put, well put. And since many pediatric specialists only take care of children, can any of our panelists up here share with us experiences you've had finding or in anticipation of needing to find new doctors to take care of you as adults? And what is it like getting care from a new person?
I have been lucky enough that my cardiologist, my last appointment with him was a few years ago before I was 21, and he rescheduled me to see me next year. And the other day I called because I didn't know if I was going to be able to see him or if I was going to go to another one. And they told me that since he had scheduled my appointment for next year, that I'm still going to be able to see him. He's a pediatric doctor, so that's why I was worried, because I know he's a great cardiologist, but I'm glad that he's going to be able to see me. So I haven't experienced that, but I feel like it has been a positive impact on me having him see me again, just because I'm familiar with him and he knows my case, so it's been great for me.
I as well haven't had to transition to a different physician. My surgeon has, he's like, you can be with me until you die, pretty much. So he's wonderful. And I am no longer going to the craniofacial clinic at UCLA. So I did have to transition out of that. But I don't think that they just requested that I see my surgeon exclusively, and I no longer have to see a group of specialists. So.
I haven't had any trouble with my doctors. I had one when I was younger, and then I switched over to Dr. Shikan, who is here today. He takes really good care of me, and I would, if I did have to change to a new doctor, I would probably ask him to recommend me to another endocrinologist. But other than that, I've been taken care of really good at Children's Hospital.
I, too, haven't really transitioned yet, but I have spent a lot of time over the past few months thinking about what I would need when I transitioned. And what I've learned and discovered is that you really need to find an adult PCP, either by being referred or asking maybe your health insurance or maybe someone that your caseworker at CCS knows, that has at least some knowledge of your condition. Because in our healthcare system as it is now, it's based on your primary care physician being able to refer you to the specialist you need, or whoever your medical home is doing the referrals. And the most important thing I can do for myself to prepare for transition is to learn how to navigate the appeals process of regular insurance, and in order to understand how to have a clear understanding of the term medically necessary, so that I can make sure to be able to get the care I need when I need it. And also, as the previous speaker suggested and Dr. Burke just mentioned earlier, the concise and short medical summary is really essential when you're meeting new doctors, because it enables them to look at you at a glance and know at least a little bit of information about who you are. Because I've had to explain my condition to a lot of doctors that I met over the last 10 years, and it's difficult to try to explain it each time. Thank you.
Appreciate that, JC. And what JC just mentioned, and what each of our panelists has mentioned for us to really take home with, is they started the conversation. And we hear the importance, as Dr. Sharma talked with us earlier, to make that so that you don't necessarily have to take by chance that you have a really on top of it 15-year-old child, or that you yourself are just ready to take the bull by the horns and say, hey, where is my concise medical summary? And that until we get to that point, that's where the importance of really saying, okay, well, until they have their transition policy in place, we're going to have to start this discussion. And each of our panelists has told us in different ways, whether it's understanding what medically necessary means, having that medical summary, asking, are you going to be taking care of me when I'm 30, becomes the opportunity there. And that's really, I feel like, the message that we're hearing. Right. Any final thoughts before we move on to our next topic? Great, guys. So we'll turn to the second part of our discussion then, as we recognize the initiative and effort it has taken our panelists to get the care they need and manage their conditions, to stay healthy and to succeed. And we have the opportunity to learn from their experiences, particularly how they went beyond just showing up to appointments. And we've already seen that our panelists have taken the initiative at the appointments to think ahead. But there's more to it than that. So panelists, as you were growing up, what kinds of things did you need to help you with to both understand your condition and take ownership of it? And where did you go to find that help?
I think that for me personally, I'm still trying to understand my condition. I've received different diagnoses with different physicians. But I think just asking questions and JC said, getting those summaries and really trying to understand and asking questions has helped me, everyone. I ask the doctors, like I said, I go to craniofacial clinics every year where I get like a holistic evaluation, from like eyes, teeth, all types of specialists. And so just really asking what their recommendations are in regards to, my condition and how I can better understand and improve my health. So just asking everyone who sees me, I ask them, okay, what do you think? Like, what should I do? What's the next step? So.
In regards to my condition, I was born with the hole in the heart. We all have it, but as we grow up, it closes. Mine didn't close. I wasn't aware of it. I would always go to the doctor every year, and they never found it out until I was 18 years of age. That's when one of the doctors referred me to the cardiologist, and she told me about it. So it was really difficult for me to understand it, because when I was young, I didn't know I had it. And I did have sometimes shortness of breath. I would get tired easily, and it would just be, I would get dizzy out of nowhere. But I would just feel like it was normal. And then when they found out about it, they told me that the reason why I was like that, it was because of my condition, because I had a hole in the heart and it was big, and they needed to close it. So I believe that it really impacted me and my family because didn't know anything about it. We didn't have anyone from the family who had any problems like that. So it was a big impact on us, but I believe we learned to get through it. When I would go to the doctor, he would always just explain to me what I had, and he would even draw pictures for me so I could understand it better. And it really helped me to go. I went to the children's hospital where I ended up getting my surgery, and the staff there was really friendly. They explained to me as well what they were going to do, and they explained to me the whole process. So I believe having others to help you and teach you what you're going through is really beneficial because it teaches you a lot. And sometimes me and my family did not ask questions because we didn't really know what was going on, and they would just come up to us and tell us and just be there for us. So I believe we learned to get through my condition just by asking questions and by having others explain to us what was going on.
Okay, I was diagnosed at a really young age, so I do have knowledge ever since I was 8 years old on diabetes. I have been taught how to regulate my blood sugars and how to manage the insulin intake that I'm going to be taking in regards to how my doctors are giving me my counts. In the beginning, it was hard coming from the Mexican culture with the Hispanics and all the food changes. We did have difficulty with managing the food in the beginning, but then once we got the hang of it and had CCS on our side and helping us step by step and telling us what to do, everything started falling into place. And now me and my family now understand how my condition goes. And there is still a lot more to learn, but once you ask questions and you're open-minded with your doctors and CCS and your healthcare takers, everything will be good and they will take good care of you.
Daniela, could you tell a little bit more specifically about some of the services that CCS provided related to education?
Okay. The CCS gives classes on how to portion out your food. It's called a program called Choose Wisely. It's 8 weeks long, and you do get a certificate at the end, and throughout that program, you learn which foods to eat, which foods not to eat, and which foods do impact your blood sugar the most. And they also do have another program where us teenagers going into adulthood can start practicing how to order our own medication at the pharmacy.
Thanks, Daniela.
You're welcome.
For me, as I was growing up, because I'm blind and deaf on my left side, I spent my early years bumping into things. The most vivid experience I had was looking at one thing and bumping into the bottom of the Sonic sign. That was very painful. Basically, I just couldn't figure out where my body was in space, because you tend to think on one side, so your right side is the center, not the center of your body. So I discovered I needed a guide dog. Well, instead, my mother acted as my guide dog for the first 10 years of my life. Throughout the years that she acted as my guide dog, she kept telling me that it was my disability and I needed to figure out what worked for me. And over the years, I learned to look at my condition and figure out what things were dangerous for me and what things weren't, and so it changes by situation. One of the most prominent lessons that I learned was acclimate. Go into a room, look at it, analyze it, and figure out how your condition is going to affect how you interact in that situation. And as I grew older, I thought I wanted to be normal, but after several years, I came to appreciate the differences my condition gave to me and realized they offered me a distinct perspective that other people don't necessarily have. And they've proven to be very valuable in my life. Thank you.
That's wonderful, JC. And what you touch upon there is, as you mentioned, your mother, is the role that your family's played in getting to where you've gotten to. And in a similar way, the family that supported Daniela and our other panelists as well through their education and in taking ownership. And so we'll take that and move on to the third part of our discussion, where we know we've heard a lot about challenges of chronic disease, disability, and that pose for teenagers, and how our panelists have shown they've thrived above those, and went beyond as they go into young adulthood. So becoming a grown-up and taking responsibility for one's condition is hard. JC's last story helps us to kind of feel that point. And it can also be exciting, right? Liberating. That's what's supposed to happen as you go from being 13 to 15 to 18 to 21 and become an adult, a grown-up, if you will. So this is the time many of us can begin to chart our own path, whether it's education, work, or love. And so this last part of our discussion will focus on learning responsibility, finding freedom, purpose, and happiness. And that starts with the families that we come from. So for the panelists, can you tell us how you were encouraged to feel independent and pursue your dreams?
Well, when I got my surgery to close the hole I got in the heart, it was a difficult time because I was scheduled to get my surgery in August, and I was going to go back to class on September, and it was going to be my second year as a student at CSUB. So it was really difficult for me because the doctors told me that I was maybe not gonna miss a semester of school. And for me, it was just really difficult because I didn't want to miss my second semester, but I also knew my health came first. And throughout my recovery time, I was able to go back to school as soon as I started in September. And I just had my family helping me out. I couldn't drive, so they had to give me a ride. They would also help me out carrying my textbooks, and they were just also there for me. So I believe that I learned that I have a lot of stuff going on, that my condition is not going to stop me from going to school. I knew that I was going to keep going, and I knew that I was just not going to give up. So I believe that it impacted me, and it showed me that sometimes there are going to be many things that are going to get in the way, and we may not be aware of it, and there's not going to be a way for us to know if it's going to happen or not. But the best thing to do is just to keep going, and even if it's something that we think it's going to tell us to give up, we shouldn't, because we still have goals that we need to meet.
And Jess, your parents and your family believe that too.
Yes, my parents were. They were also really there for me the whole time. I couldn't drive to school, so they drove me to school for about 2 months. And that showed me a lot, because if there was a point when I wanted to give up, I would see them and I would just see that I shouldn't give up, because they were trying hard for me, so I needed to try harder.
Thanks, Jess.
Yeah, similar to Jessica, my entire life, because of my condition, I always had to have surgeries during school years, during breaks. So all throughout elementary school, middle school, and high school, and in college, I would have to miss weeks. I think the most vivid challenge that I experienced because of my condition was probably in high school. I had to miss the first about 4 weeks of, calculus, and calculus to me was not easy. As a result of, me missing a lot of school, I, got my first C ever in high school, and that was devastating, and I was like, I'm never gonna get into college ever. And I did have to communicate to UCLA, which was my dream school, that I had, this thing going on in my life, and I had to miss school, and this is why I was struggling academically. And so, from my experience, I think the most important thing I've learned is that communication, communicating with everybody, communicating, with your educators, with your health staff, everyone is really important. I communicated with my parents. They understood what was going on. They were very supportive, like I'm assuming all parents are. And so, yeah, but definitely, yeah, I did not let that get in my way. And, yeah.
Great.
Responsibility does play a big role in everyone's life. And as for me, a diabetic with my condition, my family has helped me out a lot. And I do need to know how to manage my time and my health care because I do raise animals for the FFA. I have raised 2 already for my sophomore year and my freshman year. I'm going to go on to raising another lamb for my junior year. And I am heavily involved with my school with the ASB program on campus. And I do just have to make sure I communicate, like Angie has said, make sure you communicate with your educators and with your doctors what your condition is so everyone knows and they can contribute and help you out so everything flows as it should be and no one has any issues with anything collapsing with each other or having scheduling issues. So your family does play a big role and communication also does too because it helps you out tremendously.
In my experience, watching my mother take charge of her health and, when she goes to the doctor, she would make sure if she had a doubt about her diagnosis to make sure to get a second opinion. To see her take charge of her condition really gave me a strong sense of independence. And later on, when I was a little bit older, she started to explain to me the difference between a TAR and a SAR. CCS uses SARs, which are long-term authorization request forms, and regular insurance companies use TARs, which are temporary. So she taught me that I needed to monitor when those expired, so I made sure I didn't have a lapse in care. Also, communicating with the CCS program gave me a kind of a extended family feel with my local CCS department. And just being involved in my community, communication really gets you looped into your community, and that is probably the most important thing that has helped me throughout my life is being involved with my community and having the support structure to encourage me when I was feeling like I wouldn't make it. So it has really been essential for me.
Appreciate that, JC. And so we can really see that the level of independence that they're talking about, the kind of decisions that they're making, are both encouraged and sometimes expected by parents. So if you are double checking to see is Jessica and JC, are they 15 or are they 18 or 19? It's not by accident. It's by parenting, and it's by the support of the family. And as was mentioned in the Q&A in Dr. Sharma's talk, it also isn't always smooth. So can our panelists tell us what you learned from good and bad decisions related to taking more and more care of yourself, and how you learned from those mistakes, and what you feel like the good decisions you've made that has gotten you to where you are today? Go ahead, JC. You feel like you're ready to go.
No, I was just like, okay, who's going to go?
Yeah.
Do you mind? All right.
Yeah, go for it.
For me, I guess the most important decision that helped me get where I was today was when I was 5 years old, my mom came to me and asked me to make a decision, whether or not to have ear reconstruction surgery. Without the ear reconstruction surgery, I wouldn't be able to wear glasses to protect my only good eye. And being able to make that decision, being the one to make the decision, not having others make the decision for you, that really gave me a sense of empowerment and made me feel that I could make the decisions regarding my health and not have somebody else make decisions based on what they thought I needed. I made decisions based on what I thought I needed. And that was important for me. That helped me get where I am today. It gave me the opportunity to be who I am.
Anybody want to add on to that?
I mean, again, similar to what he said, I my last surgery that I had about 2 years ago, it was, again, up to me because I was an adult, and it was really hard for me to make that decision because my entire life, my parents had made the decisions for me. You know, I never had a say in anything. They were like, oh, we have, you know, you're going to have to miss school for 3 weeks because you're going to have a surgery this day. So I think the best decision, I guess, is like me taking charge of my own health care. Yeah, I think that's, you know, as a parent, I think it's really important to let them start making decisions progressively. Obviously, you're not going to ask them, do you want to have this? Do you want to take insulin, or do you not want to take insulin? But start, telling them, okay, like, we're going to check it at this time. Is this okay? Just involving them in their health care, I think, is probably the most important thing that, my parents should have done earlier and, involved me a little bit more. But, I think they overall did a good job.
Sure. Anybody else wants to add? Go ahead. Yeah, Danielle.
One decision I made was a few months ago when I went in to my regular appointments. I had talked to my parents beforehand and had started looking into the pumps, which with that pump, you don't have to be injecting yourself with insulin. And they gave me the choice of looking into it and asking my doctor about it. And once they gave me that possession of being able to do that, I started looking more into it and asking questions. And I think when you ask questions and talk to your doctors and your parents at the same time and get all the information you need based on what you want, your mindset can maybe change based on the information that's given to you and on the consequences that might occur due to the decisions you want to make. So I think that's important for parents to let their kids take their own decisions when parents feel comfortable with their kids doing it.
So for time's sake, we'll move to our last question and then open it up to the audience for questions. And that's where we come to about being 15, being 21, and how you introduced yourself. And you'll notice the audience, nobody here introduced themselves as a diabetic or somebody with craniofacial disease. They introduce their name and where they're from and what they want to do.
People first.
Yes, absolutely. And so how have you overcome the labels you carry, the conditions you have? How have you succeeded? And what are your dreams for the future? And anybody can start first, whoever is feeling inspired.
I was diagnosed with diabetes at an early age, so I would leave my classroom before lunch to go check my blood sugar, get my insulin intake, and kids did start asking why I was doing that. Once I got to the point where they kept asking, I just told them, this is what I have, and some of them do know, some of them don't, but if someone does come up to me and ask me why I'm doing it, I do explain to them, and then they understand why I'm doing it. And I have overcame this by not being shy or not being scared of it. That is a label you're going to carry, and there's nothing wrong with having a disease when you're taking care of yourself good, because that means you will live for a longer time if you are managing everything at an early age on. And in the future, right now I am enrolled in the Wonderful program, which means I am getting all my general education done. So I've been taking classes with BC. So I should have an AA and Ag business before the age of 21. So I will pursue getting into Cal Poly and going into an Ag pathway, maybe.
Awesome.
So for me, my condition is a little bit more superficial. I was diagnosed with, like I said, I have multiple diagnoses, so I just go with venous malformation, which is just the irregularity of my vein formation in my upper lip. For me, I think the hardest thing is because it is more apparent, people do look and stare and ask questions. And, when I was a kid, it was a little bit harder for me to talk about it because it's not something that, oh, I'm so sorry.
For me, with my condition, it was just something unexpected because I wasn't aware of it, and no one was aware of it. It just happened when I was 18 years of age, so everyone just took it as something that they couldn't understand either. A lot of people started asking me what was going on. They were asking me just what I had, and I would explain to them. Some of them would understand, others wouldn't. Others would just keep asking questions, thinking that um, just something wrong was with me. So I was just explaining to me that it was something that I had since I was young, and I had the open heart surgery just to close it down, to close the hole in the heart. So once I got my surgery, a lot of people kept asking me as well. They were just, I guess, the same as me. They just didn't understand what was going on. But I overcame all this by just letting it know that I just told people that I have it. I'm not shy of letting others know that I have it. I know sometimes, because I used to have the scar, and sometimes some people just randomly ask me, oh, did you have a heart surgery? And I just tell them yes. So I think sometimes it gets difficult because I just notice when people are just staring that I have the scar. And at the beginning, I was just, I would hide it because I didn't want others to see it. But then I just learned that it's something that I overcame, so I shouldn't be ashamed of it. And my plans for the future, I want to go into the master's program for educational counseling. I want to work with young children. And my goal is just to work as a counselor and maybe later just work as a psychologist and work with young children.
Yeah, I can continue. I'm sorry. So as you guys can probably tell, it's still a little bit something sensitive in me, in my life. I think that I've overcome, not completely, obviously, but I've partially overcome it just by educating people and, telling them. They do ask, oh, is it a tumor? Or is it this? Is it that? And I just, tell them, no, it's not a tumor. No, it doesn't hurt. And so I think by asking, answering everyone's questions about it has, made it a little bit easier that way. If it's people that I'm going to interact with on an everyday basis, I just rather tell them, straight up front. That way they don't wonder about it, for the year, 2 years, whatever duration that I am at that place. In regards to my future, I will be attending a master's program in nursing. My career goals are to become a pediatric nurse practitioner. I value doctors, but I'm more passionate about, working as a nurse. And yeah, that's my career goals.
Wonderful.
Karina.
Like you, Angie, my condition was a little bit more obvious. As a young age, people started asking questions. So what I did, kind of as a deflection technique at first, and later I just didn't care, but at first I used my fact that I grew long hair. People asked more questions about that than my condition. Later I just realized that it was a part of me, and it wasn't any less than any other part of me. So I suppose you'd say I grew into my condition, I suppose you'd say. And I became more comfortable with it, started appreciating the distinct perspective it gave me, and that's pretty much how I dealt with my condition, overcame. I don't really have a label because my condition is so freaky, nobody knows anything about it. Well, almost nobody. In the future, I have a desire to be a medical doctor with a focus in biological research, and that's what I want to do, but I also have a little bit of a skill for advocacy at the local level, so that may be in my future as well. I really want to help make sure that other children, like you and me, like us, are given the chance to grow up as strong and healthy as possible. Thank you.
Wonderful. So in the 12 minutes we have remaining before our next presentation, and at this point it's looking more like 10, we'll have the microphones again out across the room, and raise your hand if you have any questions for our panelists, and I'll sit down and listen.
¿Alguien tiene preguntas para los jovencitos? Muy bien. And we want to congratulate you guys for a very powerful example and lesson. Thank you so much. Gracias.
Bueno, muy buenos días a todos y gracias al CCS por haberme invitado a este evento. Es la segunda vez que vengo.
She's thanking CCS for the wonderful program. This is the second time that she's here today.
Y hablando sobre la escuela del estudio, yo les tengo una pregunta, pero quiero que se la contesten a mi hija.
She has a question regarding education, and it's an answer for her daughter.
Ella tiene una condición de impreplasia suprarrenal congénita. Ella la atienden en Madera. Aquí está el doctor, estuvo atendiéndole unos meses. Doctor, no sé cómo se llama.
Okay, what condition is she talking about?
What's the diagnosis here? Oh, congenital adrenal hyper.
Oh, is that congenital hypothyroidism?
Adrenal
Oh,
hyperplasia.
congenital
CAH.
adrenal hyperplasia. Okay.
That.
Fancy disease that affects one of the hormones that are produced in your body, your kidney, and has all kinds of effects on people growing up.
Thank you for explaining.
Entonces, por su condición, ella ha estado, pues fallaba mucho a la escuela porque muchas citas por su condición. Entonces, del distrito me mandaron una carta donde ella no se iba a poder graduar por tantas faltas.
She says that due to her illness, she had to miss school several times. She got a letter from the district saying that she would not be able to graduate because she had missed so many days.
Entonces ella se ponía triste, dice, mami, pero ¿por qué? Yo no tengo la culpa de estar enferma y no fallo por fallar. Traigo mis notas médicas donde por qué fallé a la escuela.
She says that she struggled with that because it was not her fault. You know, her medical condition, she had all the proof, all the doctor's documentation and everything to prove that she was attending medical appointments.
Entonces, mi pregunta es para ustedes, no sé si ustedes han batallado o cómo le hicieron para poder graduarse, para que ella no batalle, porque yo fui al distrito y pues ella no se puede graduar por tantas faltas que ella tiene.
She's wondering, how did you do it to, as far as graduating? Because in her case, she missed so many days at school and the district would not allow her to graduate. So how did you handle all those missed days, at class? Gracias. Thank you.
Yo te puedo contestar tu pregunta. Lo que tu hija puede hacer es comunicarse con todas sus maestras y también con sus doctores y puede preguntar por toda su tarea de los días que ella va a faltar. Así cuando ella está en la casa puede hacer toda la tarea que le dieron los maestros y ya cuando vaya para atrás se la puede entregar. Y así no faltó todo el trabajo que todos los otros estudiantes hicieron y así puede tener, no se puede desanimar y se puede así graduarse.
O sea, ¿su hija no hizo eso?
Sí, hacía tareas en casa, le entregaba
Okay.
por el distrito.
She says that the districts, what the district said was because of the missing so many days, not because she did not, she was not updated with her work, but it was because she missed days of going to school.
Thank you very much for sharing your problem. I'm Dr. Chakan from Valley Children's. First of all, I'd like to thank the panelists. It's very humbling and very teaching. Thank you. You are doing great. You are not only taking ownership of your chronic medical condition, but it looks like you developed into an advocate for all the young people who have chronic problems. So I congratulate you for that, and I hope you continue that, especially for CCS patients and patients who have chronic problems. In answer to lady who presented that problem, I want to tell all our patients or all the patients who are not our patients but with chronic problems, there are social workers, especially in Valley Children's, who can help you, and they can call the nurses, special nurses, who can be advocate for you. We have the same situation with patients who have diabetes. So some schools and school system give hard time those families, and for whatever reason they want to send the patient home, then at the end they say their attendance is low. So we are always happy to help you. So you can call our office also.
Gracias, señora. Otra pregunta que tengan por este lado. Levanten la mano si tienen preguntas. Ahí está un joven. A ver. Vamos a tomar esa pregunta.
¿En dónde?
Ok, acá, ¿dónde? Oh, perdón.
My question is for the panelists. In terms of the portable medical summary, in the future it occurs to me that this is going to have to travel electronically, either on cell phones or on a thumb drive. Have any of you found an app so that you can convert your portable medical summary electronically?
I have not, but from what I'm aware, UCLA does have a medical portal in which you can go and review your medical summaries and all that stuff. So, you know, they do have a website that I think you can log into, but in regards to apps or anything like that, I don't think so. I haven't used any.
As far as I know, you can attach it on an email or send it to your doctor's office in electronic form, take a picture of it or scan it in and send it as a PDF, but neither have I seen any app that allows you to do that.
Right, so right now, most medical institutions are still on the path to developing these portable medical summaries and getting to the point where one electronic health record can talk with another electronic health record. You'd think, as JC was mentioning, that I would just say, oh, hit email, done, and off to another doctor. The distinction, in part because federal law says that JC is allowed to do whatever he wants to do with his record, but if I have it, it must be protected and locked up so that nobody can get a hold of it who doesn't have access. And that actually turns out to be pretty difficult. Angelica made mention of some early processes where some of the larger medical records you can go through what's called a patient portal, which again, if you're not familiar with that, I encourage you to learn about. And a few of these healthcare systems can talk to each other when you give this kind of universal consent. The takeaway for us in the room right now is, like what you heard from our panelists in different places, it's still going to be largely up to each of us to say, my record belongs to me. It belongs to each of you. There may be a fee to get it, but it is your records. And one, understanding that, and then two, then utilizing that. So if you have to move to Virginia, you will then take those steps to do whatever it takes, even if it means kind of moving mountains, to get records from point A to point B.
Any more questions? ¿Alguna otra pregunta? Okay, you guys answered everything.
Un aplauso para los panelistas.
I want to thank you so much, Dr. Patrick Burke, and all of our panelists for the information and for sharing your personal stories as well. You've made a big impact here today. Thank you again.
Thank you. Un aplauso para ellos. Y ahora sí alisten sus boletitos otra vez porque va a haber más rifas. ¿Dónde está la canasta?